Hey everyone, my guest today is Peter Basica. Peter's the founder of 360 Smarter Care, a company dedicated to lowering healthcare costs for employers and improving quality of life for employees through personalized communication, digital therapeutics, and remote patient monitoring. His mission is to deliver the 360 solution to as many companies as possible so their employees can lead healthier, more productive lives and help others to do the same. With deep experience in management, marketing, sales, and process-based system design, he has built programs for major manufacturers, automotive companies, insurance and IT firms, and even a winning Detroit mayoral campaign. That same process-driven approach now guides his work at 360 Smarter Care, where he focuses on helping companies reduce healthcare expenses while improving outcomes, a critical need as rural communities face shrinking access, rising chronic disease, and worsening health disparities. He believes healthier employees strengthen families, workplaces, and entire communities, and he is committed to expanding Smarter Care 360's impact nationwide. Welcome to the show, Peter. I want to thank you for being here today.
Pleasure to be here.
Would you be able to tell the audience about yourself and what you're working on right now?
Absolutely. I have been an entrepreneur with a career that spans 6 different decades. And what I do is I fix broken systems. That's really the core of what any good entrepreneur does. And what we are working on now is healthcare. 360 has been involved in changing the way healthcare is delivered for almost 5 years now, actually just over 5 years. And when we say changing healthcare, it's because we don't have healthcare in this country. We have something I
Right.
refer to as conglomerate care. If you look at the institutional investors that invest in all aspects of healthcare, literally from delivery to insurance and pharmaceuticals and everything in between,
Mm-hmm.
the same 5 institutional investors. They could literally do the audit for the health insurance on companies that they have stock in. If they were CPAs, they'd be thrown in jail. But they're not CPAs, they are stockholders.
Mm-hmm.
And they've managed to control these companies without it becoming a monopoly because they just own the stock. There's
Yeah.
no incentive for anybody to get healthy. They need to keep the machine working. It's criminal.
Right. And that is something that people are waking up to now, and it's a huge concern for people because it 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 does feel, and it is happening, that we're not getting better with our health care. It's just managing the symptoms, keeping someone a lifelong patient.
Well, for decades, they've been talking about this is going to lower the cost of healthcare. And healthcare, of course, has outstripped inflation by multiples for decades. It's because nobody gets well. We
Right.
worked with a company, part of the conglomerate, and this will give you an idea of just how powerful they are. They manufacture a CGM, continuous glucose monitor.
Mhm.
We did a test with them using our digital therapies to
Mhm.
modify behavior in conjunction with a user wearing a continuous glucose monitor, a CGM, who
Uh,
was pre diabetic. We did a panel to prove that you could take somebody who was pre diabetic and get them by behavior modification and education below that level back to being normal. The
yeah.
results were unbelievable, far exceeded expectations. That study is going on 3 years old. They have shopped it to every health insurance company in the United States, and none of them will modify their policy to pay for this.
Right. Yeah, because then they'll lose money, right?
They'll
If
lose
people get
money.
better.
They'll lose money. And it is absolutely insane. And it
Mhm.
isn't just becoming diabetic, it's all of the bad things that happen to the body when you become diabetic: kidney
Right.
damage, liver damage, lose your vision. get a scratch on your big toe, it doesn't heal, you amputate the toe. That doesn't heal, amputate the foot.
Yeah.
It's huge dollars, huge preventative care dollars. And we're not going to do it. It's just the deck is stacked against us, and we have to wake up and
Hmm.
change the equation. The Trump administration has done a really good thing with most favored nation drug pricing. That is
Yeah.
something long overdue. Good move. But
Yeah.
they're also trying to reduce healthcare costs by fraud investigations, and that's going to go no place. That's not the problem. The problem
Hmm.
is people don't get healthy. Uh,
Yeah.
there's another interesting study from the WHO, and I'm not a big fan of the WHO, but sometimes their science is accurate.
Right.
We should pay attention to what they do right. They did a study on people with hypertension, high blood pressure.
Okay.
You have high blood pressure. Without knowing anything about the patient, I can tell you with confidence that they were told to take this pill, lose a few pounds, exercise more, reduce their sodium intake. That's 4 things you have to do to get well.
Okay.
Worldwide, the compliance to all 4 is at 27%. So it's still 73% of the people don't comply. In the United States, because we all think like cowboys and we're going to do it
Hmm.
our own way, 3%. 3% of the people get all 4.
Yeah.
97% did not, which means all those, again, similar complications, kidney damage, liver damage, strokes, all big, expensive, lifetime care required problems because we can't do the simplest things.
Right. I have suffered from knee and back injuries. And with my back injury, they said that there was like, at the physical therapist office, there's only like a 70% chance that I would fully recover. And to me, I'm like, no, I need I need 100%, but the physical therapist explained to me, well, most people will not continue to do the exercises and what they need to do if they're not forced to come to me to do them. And so yeah, I've been pain free for a few months now, but it was years of pain between the two injuries. And it takes some time, but I'm not on pain pills and I'm not debilitated from it. Do you think that we need to shift our perspective on health? Like maybe be more accountable for ourselves?
Oh, tremendously so. Uh, Through boating, I got to know a gentleman, my gosh, over 30 years ago. His name is Dr. Wayne Proposky. He is
Mhm.
a legend in the orthopedic space. As a matter of fact, I am walking around on a Wayne designed artificial right hip.
Okay.
Wayne is in Chicago. I'm in New York. I didn't want anybody but Wayne to do the procedure because he basically invented the whole thing.
Yeah.
I joked with him, can you autograph it, please? But anyway, long story short, because I'm in New York, as
Mhm.
we're planning this, is who's going to remove the stitches? We talked a little bit. You know what? I can glue it, and then you don't have any stitches to get removed later. So
Nice.
we plan this whole thing out. Typically, 14 days after the hip is installed, you go to
Mhm.
the doctor's office and get checked, and they kind of give you a release, check it to make sure nothing's moved and everything's in the right place.
Yeah.
I didn't want to stay away from my business for 2 weeks. I didn't want to stay in a hotel for 2 weeks. So we settled on a week. So I
Okay.
showed up at his office a week after I had the surgery. He
Yeah.
checked me out, he looked me over, and he said, You're doing great. And he's talking to himself. He says, I was wondering who's going to do your physical therapy. And I am getting to a point. Uh,
You're okay. You're fine.
who's going to do the physical therapy? You know, you don't need it. See, pardon me? He said, You're already doing everything after 7
Mhm.
days that after 12 weeks of physical therapy you're supposed to do. And I looked at him and it's got to be a ridiculously low bar. You're kidding me. He said, No, they
Yeah.
wouldn't do anything for you at this point. As
Yeah.
far as, health insurance, everything, you're considered healed. That's insane.
Yeah. Wow. And is that a combination between the hip replacement and your own daily habits?
My hip, and this is kind of funny, Wayne trains a lot of fellows.
Uh-huh.
So he had two fellows in there when I was in there for that 7-day checkup. And he looks at them and he says, unless you go to some remote area of Guatemala, this is the worst hip that you're ever going to see, other than a place with healthcare deserts. And
Jeez.
he's laughing, and the two of them are kind of staring at him. He
Mhm.
looks at me and he says, if you'd have waited much longer, you'd have worn a hole through your pelvis. I walked
Oh.
8,500 steps the night before my surgery.
Oh, wow.
Did it hurt? Well, yeah, of course it hurt. But I knew if I slacked off and didn't keep walking and climbing stairs, even though it hurt, my
Mhm.
recovery would take forever.
Yeah.
I had almost no recovery.
Yeah. Wow. Yeah, that it's so I used to be a CNA, and that's so interesting because patients that were at the nursing home, if they had to have a hip replacement, it was almost like a death sentence for them because they were already not very mobile to begin with, and then they weren't mobile afterwards, and it's like they always just passed so soon afterwards. It's
It is tragic, the effects of our mindset on health.
Mhm.
Our food chain is terrible. There are some
Mhm.
good things that Secretary Kennedy is doing. The red dye should have been out of our food 10 years
Yeah.
ago.
Yeah.
The stuff we put on top of our fruit, basically poison. We don't eat right, we don't live right, and our medical care is geared towards keeping us on some type of protocol that makes money for them.
It's it's so sad. How do you think we can change this?
What we're doing at 360 is basically education. We have
Okay.
a technique that we refer to as MILD. MILD stands for micro learning and micro doing. People don't change their behaviors with the snap of a fingers, they change their behavior incrementally.
Okay.
So, to support those behavior changes that are required for whatever health condition it might be, even
Mhm.
if it's just general wellness, we text message our users small, digestible bits of information to allow them or empower them to change their behavior. So
Yeah.
we'll send that small message. You'll read something, then we ask you to do something to reinforce what you just read, and keep doing it with a cadence of 2 to 3 messages a week. And over a period of 36 months, we are very successful in permanently modifying behavior. Now, of course, it's completely dependent on the user wanting to make a change to begin with. But if you're in pain, like you were with your back and knee, if you're not feeling well because you have diabetes or high blood pressure or obese,
Mhm.
most people want to get better. They don't know how. And because they're sick to begin with, just like the patients here, there's no motivation. I
Yeah.
was talking to a company that has a motion detection device that they are using to reduce the cost of workman's compensation. And the theory behind it is you put this little device on, and as you're trying to recover from a knee injury or back injury, your physical therapist can see that you're actually doing the exercises you're supposed to when
Yeah.
you're not in front of them. And he said, it took us about a year and a half before we realized that if the patient was depressed, they didn't do their exercises.
Yeah.
And I just sit there.
Yeah.
This was news to you? You're
Yeah.
physicians. The mind and the body are inextricably intertwined. You can't change one without the other.
Yeah.
that it took him a year and a half. It's dumb. And these are
Yeah.
brilliant people I'm talking to. They're just so
Yeah.
tunnel visioned. Maybe it is all the specialization in medicine. But
Hmm.
then I go back to somebody like Wayne, and Wayne's an inventor. Um, Years ago, they used to cement in hip replacements. And when
Oh,
you
jeez.
cemented them in, there is corresponding over the years bone loss.
Yeah.
The Poprosky evaluation is used worldwide. I bring this up just to give you an idea of how important this man is to orthopedics. As brilliant as he is, unlike most specialized physicians that I've encountered,
Hmm.
Wayne's a guy that you want to sit down and have a beer with. He's a well rounded guy. He can talk about everything, and he understands people.
Yeah.
I get the impression that most specialist physicians don't understand people. Primary care doctors get it. Um,
Hmm.
I'll give a plug to the DOs. Those people have been holistically treating people for decades.
Yeah.
It's a healthier way to practice medicine in some respects. So I'm not sure exactly how we change everything, but
Hmm.
I know what we are doing is changing lives.
Yeah.
And in our world today, the biggest challenges we have are not physical health, they're mental health. Stress, anxiety, and depression are at levels that we have never seen before in children, teens, and
Hmm.
adults. And it's impairing their ability to live their lives.
Yeah. Yeah. I I can totally see that. I'll have anxiety sometimes and I have to regulate that with exercise. I I don't need medication. I just need to be able to go and do some exercises, kind of blow off some steam, and I'm lucky that that works well for me. But then also when you're eating junk food all the time, that doesn't help your mental health either. It's like diet and exercise seems to in from my experience goes hand in hand with your mental health. Is that a correct assumption?
Since computers were created, there's been an expression: garbage in, garbage out. Put
Yeah.
garbage food in your body. Gee, can't imagine. It's garbage out. You
Yeah.
see the results. You say you're lucky. I say you're proactive. You've decided to do something to deal with your anxiety.
Mhm.
And that's a difficult thing to do. None of the things I'm talking about, I want to imply, are easy.
Right.
But nobody ever said life is supposed to be easy. Anything good takes some effort. And you're making the effort to deal with the stresses that you encounter in modern life. Most people don't do that.
Mhm.
I have a theory that there is no such thing as stress or pressure if you are doing what you want to do in life. It's simply work. Very few people will approach it like that. But it's, I think, in the DNA of anybody who's an entrepreneur. You're trying to change things so that you expect resistance, and you expect
Yeah.
when you get it, it's, well, of course I'm getting it. Regular people, non-entrepreneurs, maybe that's a better way to say it.
Okay.
Well, no, that's personal. They're incorporating it at a level that probably isn't appropriate.
Mhm. Right. Yeah, I I I think I perform better with a little bit of stress. If I didn't have a busy schedule or enough to do, I I don't think I know I would just become lazy, you know?
Absolutely, I'm sure you've heard the expression fight or flight response.
Mhm.
That's a misstatement, and it's so common people take it as fact. It's fight, freeze, or flight. So
Oh,
some
yeah.
people, when their life is threatened, will literally freeze and be incapable of reacting.
Yeah.
Other people stand and fight, other people run. But the interesting thing is the freeze.
Yeah. Yes, I have done that before.
It's in our DNA. It's in
Yeah.
absolutely everybody. Uh, when you know what's in your body, when you know what's in your mind, it's much easier to deal with it.
Mhm.
So, in our education of our users, we literally will start them out with this is your brain. This is your brain and how it works. And then we talk about how to literally rewire your brain,
Mhm.
neuroplasticity. It is possible. It's proven. You can see it with MRIs. This is how you rewire your brain. There are things that people can do that will put off Alzheimer's and aging in their minds. And it's as simple as brushing your teeth with your opposite hand in the morning.
Really?
Are you right handed or left handed?
Right-handed.
Uh, Tonight or tomorrow morning, when you go to brush your teeth, start with your right hand and you'll see how easy and complete it is.
Yeah.
See what your left hand does. It will
Uh,
be a strange activity.
yeah.
And
Yeah.
as you work on that, what you're doing is creating new electrical pathways in your brain. So it's
Okay.
as simple as starting to brush your teeth half of the time each day with the opposite hand. It gets more complicated. Try learning a new language if you're not somebody who easily learns languages.
Uh-huh.
I started reading complex science fiction because I've never read it. I haven't
Okay.
studied physics. And there are certain science fiction books that really put that engineering into the text. I have to really stop and think. So 15 minutes a day,
Yeah.
literally here in my office, will sit down, pick up a book, and read that just to stimulate growth and flexibility and resilience in my brain.
Yeah.
It doesn't take much, but it does take some effort.
Right. Yeah. I'm starting to think of all the things I'm gonna start making my husband do now.
Oh, and you're going to blame me. Great. Add some stress to my life, huh?
I've already been on his butt for reading, and he was, and then he kinda petered out, so he's
It's hard to maintain those habits.
yeah.
And when it stops, so many people get discouraged. But if you know that's going to happen, you say, well, I kind of had a hunch this might happen. I'm going to start again. And you
Right.
didn't fail unless you stop trying.
Right.
And there
Yeah.
will be a series of failures before it becomes a new way of doing things.
Yeah.
But your brain needs to know that when you start so that
Right.
you don't get discouraged.
Yeah.
That's what we mean by empowering people with knowledge. When you know what to expect and you know how to make the change, you are now empowered to make that change.
Right. Can you tell me more about, like, the text messages and stuff like that that
Uh,
users can benefit from?
Absolutely. If you are enrolled in our Smarter Self program, which is a program we have for high school students, we
Okay.
refer to it as being a performance coach in their pocket. The idea behind it is if we improve their ability to deal with stress, anxiety, and depression, if we improve their ability to study and get a better grade, if we improve their concentration so they can raise their free throw percentage level,
Yeah.
they will gain the mental strength and resilience to deal with life as it is today. So, as an example, those students can text a message back to the system that says, I'm I'm having a rough day. They're going to get a message back that says, it happens. Lots of people have rough days. You can recover from this. And the recovery will include a hyperlink, for example, to a breathing exercise to relax, or to a meditation, or to an article on stress. And as we learn about each user, we curate the type of information we send. Well, some people want an X. They want their, used to be 140 characters, give it to me in a bullet.
Yeah.
Other people want a white paper. Other people want to listen to something. Other people want to see a video. So we know people learn in different ways.
Right.
Once we identify which is their preference, we'll feed them more of what's effective for them.
Okay.
And we provide each of our users with a dashboard or a home page. The very top of the home page, at that top third, let's call it, whenever you visit the page, it asks you how you are. If you say, boy, I feel great today, you're going to get some ridiculous thing to put, enlarge the smile on your face. Like Farrell singing Happy. And we're all tired. Yeah, you're smiling just thinking about it. If you say, I'm stressed or that, you're going to get a different message. And when you answer that, the next third of your page gets populated with information that you need today because of how you indicated. And the bottom third of the page are your favorites. I really like this article. I really like this video. I really like that meditation. So when you need those things, they're there at your fingertips. That's why we call it a performance coach in your pocket. When kids are in school, and they're only in school half the year. With all the holidays, they are literally out of school half the year. And of course, the school resources disappear after 4 o'clock. They're not available on Saturdays and Sundays. So you break up with your girlfriend, boyfriend, whatever, have a blow up on Friday night. Where do you go to get help? And the answer is, go to your Smarter Self page. You've got the tools there that you need. So we give them a 12-month curriculum that starts at first year you're in, let's call it 101.
Okay.
At 101, you're getting entry-level information. The second year gets more advanced. But we include, for example, this is how your brain works. We have a test anxiety section. We have a section on managing your social media feed, that constant flow of information, how to control it. We have one on bullying. Unfortunately, we have one on grief management because they're, unfortunately, in most of our cities and dense suburbs, we basically live in a combat zone. And people are getting shot or stabbed or beat up. So we have a grief management section. And each one runs 30 days. We run 12 months so that we're there during vacations and summer and spring when they lose their resources. But that's our approach to everything. Knowledge is power. Let's give you the knowledge that you need right now to deal with your life right now.
Yeah. That's really cool because I do think that teenagers especially, they're going through so much and their emotions change so quickly that I think having that resource available to them right away can be so helpful to them.
Sorry to interrupt. I just wanted to tell you about my sponsors real quick.
Sometimes I get on a roll cleaning or gardening and I need a boost but don't have time for a meal. Big Fork Brand's pork jerky is the perfect choice to keep my momentum, offering high-protein snacks for on-the-go energy boosts. Not only do they offer pork jerky, but they also make pork sticks, bacon sausage, bacon hot dogs, and burger and hot dog sauces. Products come in a variety of delicious flavors, including Thai green curry and maple and brown sugar for the meat options, and gangster and Chicago fire for the sauces. I personally think the original flavor of the pork jerky hits just right after tackling a big chore. It's a little salty and very flavorful. My discount code gives you 20% off your entire order, and it's currently the best deal available. Just visit bigforkbrands.com and enter in my promo code JADE, that's JADE, at checkout. Are you looking for a gift for a music lover, or maybe some apparel to show off your quirky side? Old Glory has you covered. With over 300,000 officially licensed items covering music, sports, entertainment, and pop culture, you're guaranteed to find the perfect item. They even have seasonal gear. My husband enjoys the Beatles and Led Zeppelin apparel, and I love the Billy Idol apparel. I even found items for my fellow plant enthusiasts. This family-owned superstore is known for their quality and customer service, offers free standard shipping on all orders, and orders are shipped the same day you purchase. My discount code gives you 15% off your entire order, and it's currently the best deal available. Just visit oldglory.com and enter in my promo code JADE, that's JADE, at checkout. Looking for a game-changing way to improve your health? Zevo Life is the world's most nutrient-dense whole plant, packed with over 50% plant protein, essential amino acids, fiber, and antioxidants. Harnessing the best nature has to offer, Zevo Life nourishes your body while driving your performance, vitality, and overall well-being. Each serving is a concentrated source of clean, well-balanced nutrition designed to support modern lifestyles, and just 1 teaspoon a day supports your gut, boosts energy, and promotes healthier skin and hair. It's no wonder that it's receiving rave 5-star reviews. Step into a healthier future with a 30% discount and a 30-day risk-free guarantee by visiting zivo.life and using my promo code. To support my show and to receive 30% off your entire order, enter in my promo code JADE, that's JADE, at checkout.
The second leading cause of death for young people in our country is suicide.
Yeah.
Now, have a school shooting and everybody's up in the air. And I don't mean to say that's not a horrible thing.
Right.
But when you say teen suicide is the second leading cause of death, there's no outcry. There's no outrage. I don't understand how you can care about one and yawn about the other.
Right.
So again, school shootings are horrible.
Yeah.
Teen suicide is horrible.
Right.
Both of them bother me equally.
Yeah.
When you look at how our tax dollars are being spent, 99% of them are being spent on crisis intervention. I understand why. Think of it as a fire department, a mental health fire department. What do you focus on? A burning building. That's what people think the fire department does. That's not true. The fire department spends over 90% of their time preventing fires.
Right.
Inspecting buildings, trying to not have the fire. We're spending 99% of our money on emergency response, fighting the mental health fire, and doing minimal work in prevention.
Mm-hmm.
We need to invest most of our money in prevention.
Yeah.
There's a shortage of mental health workers, and the gap just keeps growing. The projections, even with more and more people moving into the field, the gap gets bigger, bigger, and bigger. We will never catch up unless we reduce the need for care.
Yeah, that, and that's not something that you hear about. We hear about the growing, the aging population. There's going to be a lot of people, like, they're almost prepared for an influx of the I guess someone told me the boomer generation, they're going to start needing more healthcare because they're getting older. And everyone is kind of bracing themselves for that. But no one talks about preventing them from needing the help in the first place. It's, but again, there's a reason for that.
You are exactly right. Oh, we need more doctors. We need more nurses. No, you need to get them healthier so they don't need these things.
Yeah. Absolutely. It, so yeah, I like that your program. It's you can do it at home because really, those life changes need to be made at home. Like you can go to a doctor, and it's important to have a doctor that has your best interest in mind. But most of the work it happens at home, so the
You
access is
are
perfect.
100% on point. It is the patient. And part of the reason that people don't do what the doctor asks them or tells them to do is a lack of trust.
Hmm.
If you're alive today, you went through COVID and we politicized everything. The example I like to use is the Trump vaccine.
Hmm.
Operation Warp Speed was a Trump program.
Hmm.
Operation Warp Speed was amazing. They developed a vaccine that worked and literally started being distributed in December before he left office.
Hmm.
Every Republican loved the Trump vaccine. Joe Biden took office. Before I go to Joe, every Democrat hated it.
Yeah, right.
All right, we move into January, and President Joe Biden takes office.
Yeah,
Suddenly, the Republicans decided it was poison,
yeah,
and the Democrats loved it. The
right.
vaccine did not change,
Yeah,
but we politicized it. And that's a real problem because it was science.
yeah,
When people lose trust in science and lose trust in their doctor, that's a real problem because it
yeah,
has long term, permanent negative effects. And rebuilding that is just a massive, massive task.
yeah.
There has been bad science in the past. In the 50s and prior to the 1950s, you had a primary care doctor that made house calls.
Hmm.
That doctor literally was your mom's doctor. Your mom had a baby, well, delivered that baby and was a baby's doctor.
Yeah,
That baby grew up and that doctor delivered those babies. They weren't just a doctor, they were part of the family, they were trusted. You know, my father with our family doctor, if they had said when I was sick, go stand on the roof, fly a kite with a key, wait till it gets struck by lightning, he'd have run out there and done it. They trusted them implicitly.
yeah,
In the 50s and 60s, we did crazy things and had some really bizarre research. And it changed that paternalistic relationship with the family doctor. I was watching a show the other day and I was just absolutely stunned. It was set in the late 1960s. They were talking about somebody with epilepsy and referred to the seizures as fits.
yeah.
That was in the
I,
late 1960s, not the
right,
1800s.
right.
They were still doing lobotomies
Yeah,
in the 1960s. We had the thalidomide baby deliveries and just a lot of things that were bad medicine.
right.
And that's when patients started to get on an equal footing with the decision making with their physician.
Hmm.
And over time, right now, every study I've looked at shows that roughly 50% of Americans say they have a personal doctor. But when you drill down into the studies, it gets down to be 5 or 10%, because what the majority of people are saying is they go to the same urgent care center,
Right, right.
not a
Yeah,
family. Uh,
yeah,
so the lack of having a relationship with a doctor that you know,
yeah,
who actually knows who you are, and having trust in what they say is a huge barrier to that patient following their care plan.
right.
I am in New York City, which is a healthcare mecca. Uh, I am fortunate enough to be able to have concierge care medicine. I have my doctor's cell phone number. I can call them anytime, night or day.
Yeah.
She will actually make a house call if I ask. When
Yeah.
I first started working with her practice, I told them that their job was to keep me standing because I'm building a new business and I don't really care about anything other than being in the office every single day. And if I have to be there 18 hours a day, your job is to keep me standing up.
Right.
Well, she looked at me and rolled her eyes. Well, it's been a couple of years now, and sure, I am finally listening and eating a little bit healthier and exercising a little bit more.
Mm-hmm.
But it's taken time to get that working relationship and for me to actually listen to somebody.
Right.
Part of the reason I'm not listening is I'm an entrepreneur. Of course, I'm doing things that I'm not supposed to do, that I'm taking my own path. So
Yeah.
to listen to somebody and follow the rules over here when I'm breaking the rules every day at the office,
Yeah.
but the physician has to understand that. And over
Yeah.
time, they understand how to poke you and get you
Yeah.
to understand that, yeah, this is a rule I'm going to have to listen to. But that shouldn't be a privilege of somebody who can afford to pay for it. That's how medicine
Right.
should be practiced.
Right.
Which actually leads to another one of our solutions. I actually just came back from Taipei where I spoke on delivering rural healthcare. Can't believe that our little company has been introduced on a global stage, but it has.
Yeah.
And we refer to it as Go Direct Care. And what we
Okay.
do with it is use technology to go backwards. We use technology to increase the amount of physician or PA or nurse contact with the patient. And
Okay.
what we're doing is taking a series of tools from AI to actual devices to software integration and creating a path that empowers the physician and patient to practice proactive medicine.
Mm-hmm.
We start with a device that goes into the home that literally allows you to pick it up, turn it on, start an interaction with the physician's office, and that physician can see not you on video, but see you
Yeah.
on video with a device that you put in your ear, act as an otoscope, and they see an FDA approved medical grade diagnostic image of your inner ear.
Oh, wow.
Oh, wow.
Yeah.
Look at your nose, look down your throat, listen to artery sounds, listen to chest sounds, listen to bowel sounds. Put
Mm-hmm.
your finger in the device and it takes your pulse and tells the physician what your blood level oxygen level is.
Yeah.
It'll do a simple 2-finger EKG or a 12-wire EKG. So literally 75% of physician-patient interactions can be handled from the home.
Mm-hmm.
With that device and being able to monitor things that way, that gives the physician or the physician's office a lot of power. But
Yeah.
people have a lot of wearables. That CGM I talked about earlier dumps your blood sugar level, A1C, into a database basically every day on your phone.
Uh-huh.
But it's raw data. If you're a diabetic, our software allows the physician to say, when your A1C level goes above this for 2 days, 3 days,
Mm-hmm.
5 days, whatever they want to set it at, we then send a short communication to their office saying that Sam's A1C has been above the designated level for 3 days.
Yeah.
It allows somebody from the physician's office to pick up a phone and say, hey, Sam, what's going on? I see your A1C's here. When they ask that question, we'll just make it simple for your listeners. It's going to get answered one of two ways. I'm on a cruise ship. I'm sitting by the pool. I'm on my fifth pina colada. When I get home
Yeah.
on Sunday, I'll go back on my diet.
Yeah.
Bad plan, but we understand. The flip side is, I know I've been watching it. I've never eaten more carefully. I'm exercising more. I'm doing
Yeah.
everything I'm supposed to do, and it just keeps going up.
Right.
Sam, let's start with some blood work. Let's figure this out before it becomes a problem.
Yeah.
Connected to all of this is a research element. And we've been working on this with the University of Illinois, Carle, Illinois College of Medicine, Medical School, Carle Health in Champaign to deploy a pilot of this program
Hmm.
in rural Illinois. We're also working with University of Rochester Medical Center in New York, University Hospital in New Jersey.
Yeah.
But there's a research element. University of Illinois had one of the first supercomputers. They're a world leader in computing, AI, data management, research. So we will be creating a database of these patients. And this
Yeah.
database will, of course, be de-identified to protect patient privacy.
Right.
But it will have information that a normal medical database doesn't. It will have the patient's DNA that is connected to whatever chronic conditions or conditions, diseases that they have.
Hmm.
It'll have the physician's notes. It'll also have, because in a university setting, environmental determinants. Oh, they
Yeah.
live over here and this is sprayed. There's a high concentration of this in the air, but whatever it is, those will be in there, as well as social determinants. So, in other words, it will be the only medical database that we're aware of that has everything from DNA to patient's notes to the environmental conditions under which they live. And it will have students and medical professionals doing research. And we believe
Right.
it's the students that are going to generate the breakthroughs, not
Yeah.
because they are smarter than a doctor who's been practicing for 20 years, but because they're not constrained in a box of what they have been doing for 20 years.
Right.
They'll ask
Right.
questions that would never occur to that physician. And because of
Yeah.
those queries to the database, we believe we will see medical breakthroughs that over time improve health, reduce the need for care, and lower costs. So you
Right.
put these three things together, and it's an entirely different way of practicing medicine that should reduce care costs in every model we've created. And every physician that's looked at it to date agrees with it by 25%, which is
Right.
huge, huge. I mean, just think of your healthcare premium dropping by 25%. Uh,
Right. Yeah.
People would be celebrating that because it's a huge amount.
Yeah. I mean, this seems like because something needs to change. And and giving the people a way to change things for themselves, it's going to be the only way to get the healthcare system to do better for their patients. I mean, you have to hit them in the pocketbook, and if you can get them to go to the hospital or, places less often, then maybe they'll start offering better care. Do you think?
It's interesting as we've presented this to physicians across the country, what
Mhm.
their response has been. The initial response is, who the hell are you to tell us how to practice medicine?
Right.
And my answer is by introduction. I have been fixing broken systems over 6 decades now.
Mhm.
This is a broken system. It's not broken because of the people in the room that I'm talking to. It's broken because we have actuaries and bean counters making medical decisions and telling you how to practice medicine.
Yeah.
When I say that, they start to listen. When we present the program in detail, their first question is, well, who's going to pay for these things that you're recommending that aren't currently covered by insurance? And
Yeah.
our answer is, it's one of two ways. In the one big beautiful bill, there is $50 billion set aside for rural health transformation. That would
Okay.
be one place. The other is we are working with some private investors to do this entirely on our own without any government involvement, which would be my preference.
Mhm.
we're going to need to cover the cost of that device that we send to the home. We're going to
Right.
need to cover the cost of our software that communicates between the. So roughly 10% of what we're talking about, maybe 20%, will have to go in our pockets to fund.
Right.
Once we prove this out, the insurance companies are going to have to cover these things.
Right. Right.
We will force them to. And making our research very, very public is part of the plan to take on conglomerate care.
Yeah. That sounds perfect. Is there anything else you'd like the audience to know?
Wow, great question. They may be wondering why we're doing this and what the motivation is.
Uh-huh.
The answer is I started this company during COVID, looking
Yeah.
at the refrigerated trucks filled with bodies at the hospital down the street from our home in the financial district in New York.
Yeah.
It was anybody in the country who wasn't in New York during COVID can't understand what it was like here.
Yeah.
Because of the population density, it was horrific. There is no other word.
Yeah.
I woke up and I told my wife at 2:30 in the morning, I got to get so-and-so, so-and-so, and so, a doctor, a behaviorist, an insurance person. We're going to change healthcare. I have a plan.
Yeah.
And she's like, are you out of your mind? I'm at the age where most people are retired.
Mhm.
My wife is a saint. She let me take our retirement savings and pour it into this company. This is legacy for my family and
Yeah.
legacy for everybody that works here. I've been an entrepreneur my whole life. I've lived in the penthouse, I've lived in the outhouse. I've made a fortune, I've lost a fortune. All entrepreneurs go through those cycles. What we haven't done is changed enough lives that my children can look at this and say, damn, mom and dad really did something.
Yeah. Yeah. That's really cool to think about it that way.
So yeah, it's legacy. We are going to
Yeah.
do the right thing for our users, our customers, and by doing the right thing for a whole lot of people, we will make a lot of money and we will
Yeah.
save them money and everybody will be happy because there isn't a loser in this whole chain.
Right. Right. So what is there any part of this that people can use now?
Absolutely. If they go
Okay.
to our website, the digits 360 smartercare.com, through their company, they can enroll in our systems. Uh,
Yeah.
that's how we get it funded is companies with self-insured healthcare programs. When claims are paid, it's paid with the employer's money, so they actually have an interest in reducing those claims.
Yeah.
Uh, so through their employer's health plan, we, boy, knock on wood, this is a premature announcement,
Mhm.
but it appears that we have money coming from the state of New York to actually turn on our R&R program. It stands for Rest and Recreation. It's a
Okay.
military program for veterans with a unique feature in that it has an anonymous, a confidential chat room that they can enter to talk about what is haunting them and bothering them. And it's virtually impossible for anybody to back into who they are. Roughly a third of
Wow.
veterans suffering with PTSD only need to talk about what it is that haunts them.
Yeah.
Second third needs to be involved with a group, and the final third needs professional help. The best counselors for veterans with PTSD are other veterans who have walked in their boots.
Right.
That's who will populate the chat room. So the veterans of New York will, before the end of 2026, have a place that they can go to start their journey to overcome the things that haunt them. Uh, It appears we're going to do the same in New Jersey. And as we prove this program out, we intend to roll it out to all 50 states. Less
Yeah.
than half the veterans in our country actually apply for benefits through the VA. They don't trust it.
Right.
There are
Right.
22 veterans, and it all depends on how you count. Some will say it's only 18, some will say it's much higher. But there are 22 veterans a day as the accepted number that commit suicide every single day.
Right.
22. And that number has to change.
Yeah.
R&R, with the help of some state governments to be able to get it out there, we will be able to do just that. And as I say, I believe we will launch those programs in New York and New Jersey, and those are free to veterans and free to veterans' families.
Wow.
Their families suffer along with them.
Yeah.
So there is help there for their families. There's help there for the veteran, and those will be completely free of charge. In New Jersey, with the help of the New Jersey state government, we are providing Smarter Self to any New Jersey student in any high school. And we will have a registration program live on Instagram in the next 90 days. And
Okay.
that will be free to those students. So lots of places. It's coming.
Yeah.
The 360 snowball is finally rolling downhill.
Yeah. I'm excited to see it reach Iowa finally. I'm going to be spreading it all over because there's so many different services that you'll be offering that it can help everyone in some way, shape, or form.
That is the goal.
Yeah, that's so cool. I'm really excited about this. So
I'm glad that those are the things that keep us motivated.
yeah, right. I want to thank you for being here and telling me all about it and now spreading the word to my audience. And once again, where can they find you?
360 smartercare.com. That's the digit
Okay,
360 smartercare.com.
perfect. I will put that link in the show notes so everyone can find it. And yeah, I want to thank you for being here today.
Sam, it's been a pleasure.
Yes, likewise.